I know that one of the things we've asked our audience to do is to, while they're listening to the conversation today, to maybe be coming up with questions that they might have, and we'd love to involve our audience right now. If you guys are okay with taking some questions, we'll see if we can, if anybody has any questions, we'd love to hear what you have to ask, and hopefully provide some good answers.
Sure. Liz, you mentioned that more people will now have access, and so there is some concern about timely access and how that goes. And I think that's one of the things for us we are somewhat concerned about is how do people get timely access to quality care, and knowing our own parishioners who work in healthcare provider situations whose hours have been reduced in order to manage in this system as a large employer, as you said. Do you have advice as to how we can counsel employees on here are the kinds of questions to ask, here are the things to seek as we move forward, knowing that you may encounter your doctor now has 4 months before you can get in?
Right.
You know, are there ways, are there resources, are there ways that we can counsel our employees?
Boy, those are great questions. And other than just the long-term structural things, which is kind of getting over that wave of new access that we anticipate happening, you know, if they've been getting care somehow before, hopefully they will be doing the right thing for themselves and us, which is to get into a good primary care relationship. In the short term, if they have to, I would hope that they would not be afraid, maybe, to say, we can get you an appointment with a nurse practitioner sooner and with the primary care doctor a little bit later on. I would hope they wouldn't have a bias or a concern about seeing a nurse practitioner early on, because honestly, that's going to be the key to delivering good quality and good coordinated care in a timely way. And actually, Scott, you could probably speak to that as well. You use nurse practitioners
I think
in your
those are great questions, and those of us in primary care are certainly interested to try to help get our patients access. And for those to address the issue of what we call mid-level providers, nurse practitioners, physician's assistants who provide excellent care, and I think I think many in our society are realizing after experience with some of our nurse practitioners and physician's assistants that they do provide great care and can feel confident. Certainly in our case, we wouldn't have a nurse practitioner that wasn't delivering good care, and they deliver that. And we're thankful for that. So trying to provide access is a big deal. And I think everybody in the healthcare environment is trying to sort through how to do that more effectively. For people who may access a new insurance plan and for the first time have insurance in a long time, who do they call? Most of the healthcare providers, hospital systems and all, have organizations or departments that help give direction to different primary care providers that are available and are taking patients.
So I'll add one other quick thing, which is I'm sure people are thinking about what about you know, those minute clinics or you know, immediate access care clinics. I think as providers we wouldn't want to discriminate there either. We think that those are good resources, and if they obviously can't get into a primary care in a timely way and they need something, by all means, use those organizations. One thing we would ask, I guess, and I'll speak for you a little bit, is be sure you let your doctor know that you have sought out care there. Most of those organizations actually do try to integrate very well with. They don't want to try and steal patients away from physicians, and we as physicians and hospitals don't feel that we need to compete there either. But what we do want is that information should be integrated. And so if you sought care because you had an urgent problem, let your physician know that. They will pass your records on to that physician as well. But we'll get through it.
Shared information is powerful, that's for sure. Yes, there's another question.
The two questions that I think I've heard you say is we should ask how many employees do we have in terms of how the Affordable Care Act will impact us. How many employees do we have? And then are we currently offering some health insurance product to our employees? Correct?
Correct.
Correct.
All right, and so my question is, what other questions should smaller organizations be asking beyond those two questions?
By smaller, would we define that as the 2 to 49? Questions that they're going to have are considerations. Take a look at how community rating impacts upon them. Community rating applies to only by ACA, individual and fully insured small group. So the first thing is going to see, how does this price affect you? You know, as an underwritten group, if you have the group, what your pricing is now. Community rates can be supplied without any questionnaires or anything else, okay? Because risk cannot be a factor. It's going to be based on the demographics of the group. So compare to see how community rating impacts upon you. Then you can start looking at some other options. One may be a shared employee PEO type arrangement, okay? To do that, there are a number of different PEOs. Hopefully you can find a broker consultant that's familiar with one. I would go to your current broker initially and ask him if he can help direct you to a PEO organization. You may ask him about the self-funded alternative. You know, self-funded was traditionally thought by many to be only for very large groups, but there are going to be new products issued that are filed as self-funded, so they won't be subject to the community rating. At this point in time, that could change. Okay, if that's seen as a loophole to get the healthy out, there's a potential that might change. But for currently, the partial self-funded option, we're seeing more and more issuers that are going to do partial self-funded, some down to as small as 5 employees, many doing it at 25 to 49. I don't know if that answers. Does that help? Okay.
Bob Brink, pastor, Decatur Church of God in Decatur, Indiana. And I have a couple, I think, related questions. One, for a church that has not paid any health care coverage on any of their staff, that's less than 50, they're not required to pay any.
The employer mandate does not apply if you don't fit into the category of 50 plus, or when you go through the full-time equivalence calculation.
And is this a setting where I can ask about individuals who are pursuing coverage and that are not in a group?
Absolutely.
Sure.
All right, question then, in regards to the individuals, we all know the marketplace is not functioning appropriately at this point.
Yeah.
Might I go on record in saying that it stinks?
Yep.
The question I have, are there options for those individuals to find other methods of pursuing this other than going on daily, putting in all their information, and then being kicked out and losing it every day that they, in other words, hours every day that they're pursuing this and getting absolutely nowhere. So is there another option other than going through the marketplace? And is it not only an option, but is it a worthwhile option?
I believe
Well-
so. You've got
well,
your
sure, there's a-
navigators.
Yeah, I mean, they should talk to one of the navigators. They really should, and through whatever organization they find it, because it's not that you're not going through the marketplace, but they can enroll on paper, and they can enroll by phone. And in a lot of states, you've probably heard even like Oregon, for example, was doing almost entirely in paper enrollment. It's tedious and it's not fun and it's not the way anybody wanted it to work, but they just take all the same information that you would have completed through the online screens if those were working timely as they should. Get all that information, get that application done so that it can get processed behind the scenes just in the old-fashioned way. So they should absolutely be doing that. And rather than, as you said, getting frustrated by spending an hour every day trying to do it, talk to a navigator and say, give us a little heads up about when's a good time to try this. And you know, one thing to remember, although it's been way more frustrating than anybody expected, something good that has come out of the folks that have been able to get through the exchange, or I'm sorry, the marketplace website is lots of folks got through it far enough to find out that they were in fact eligible, or they or their kids or their spouse were eligible for Medicaid. And then that was what that no wrong door model was supposed to do, was say, go to one place, find out, are you eligible for insurance subsidies? Are you able to buy insurance here? Or are you in fact eligible for a different program that now you should get enrolled for? There's been a lot of outreach done to try and get people to go at least that far to find out, are you eligible for a program that you didn't even know you were, or that you are now eligible for?
The coverage not going to be effective till January 1, so that's not that far away any longer. But what we're suggesting to the majority of our inquiries now, we're suspensing the names, and then we're getting back in contact, reaching out to the people directly once we see functionality.
Yeah.
Okay. When might that be? You know, again, there's no definitive answer to that, but there are a couple components in this. On the individual side, the links have not been tied together yet for enrollment purposes in the state of Indiana, and I'm speaking of the state of Indiana for individual products, with the issuers, okay? Once that connect's made, I think we're going to see enrollment being much easier, okay? Get another alternative to enrollment.
Maybe one question kind of tying into what this gentleman is asking is if the you mentioned earlier, Dave, that the open enrollment extended to the end of March. So if someone has been frustrated in the last few weeks trying to get access, if they waited until sometime in December or January or February, as the case may be, would that be an issue in regard to them being able to get on and hopefully find a little bit more efficient process and yet not be penalized? Would there be any penalty in relationship to the timing of the enrollment there?
I think a lot of that's to be determined with the problems that exist right now. Okay.
But I think there's one question that you're asking here that, if I'm hearing it right, is this. If you want to get, because you don't have coverage and you want to get coverage by the first of the year, you have to keep working, and you would have to actually successfully enroll by the 15th to be covered, the 15th of December, to be covered on 1/1, but differentiate that from to avoid having to pay the individual penalty for not getting coverage. That's through the end of March, and that's the part that might also be extended a little bit to. So, is that part of your question too? Yeah.
That's exactly part of my
Yeah.
question, because
Yeah.
I know a number of people who are losing their coverage
Yeah.
as of the end of this year, even though the government now has extended out a month here.
Yeah.
or
Yeah.
and this week
Yeah.
getting it back.
So for those
They're being
people.
pushed to get it in December.
Yep. And so for those folks, my best recommendation, and I'm not a navigator either, but would be to go to the navigators and see if by starting the process on paper or starting the process by phone, if they could get through it in a little bit less painful way than, trying to work through the website.
My name is
Yeah.
My name is Denise Cribble. I'm with Anderson University, clearly a large employer. However, we do have some people that are part-time. Can you address how those who may be eligible for the subsidy will receive those subsidies? Because I've heard different things. And also how those that do not enroll in coverage will be penalized. How will that penalty be assessed? How will the subsidies be received or awarded, or whatever term you want?
Try to address that. Denise, the penalty will be based on income. Okay, there's certain income levels that will not be subject to the penalty. Go ahead.
But the question is, how, if I am eligible for the subsidy, will I get that in my hand? Will that be a reduction in my monthly premium,
Yeah.
or will
Yes.
that be, okay, because I,
Can
not
be
a
an
cash to
it
you.
can be an upfront
Yeah.
credit paid directly to the issuer to reduce your cost of coverage. So you're not going to have to be concerned about waiting for that as reimbursement.
okay, because I had heard that it would be given as part of a tax refund, so,
Yes, it
That's
can
helpful.
be. It can
Thank
be a credit up front.
thank you.
Other questions?
This kind of piggybacks on Denise's question just a bit. And, I'm wondering, in the room here, for example, I know there are a number of leaders, pastors, leaders and directors, administrators for not-for-profit organizations. And many of their employees, are not highly compensated persons. They're doing what they do because they care for people and want to serve the Lord. And in that, I'm wondering, again, from the subsidy position, there's some helpful information that was in our packet relative to the subsidies and how they work with multiples of the federal poverty rate. And so in those circumstances, is it likely that small employers, churches, not-for-profit organizations that are in social service areas of work and ministry, would it be in their best interest for those employees of those small employers to enter in through the system? And as it appears, will they actually maybe benefit over having no insurance, which many of them are functioning without insurance, or even if they're in a plan that they've tried to cobble together, is this going to be an improvement for them in the end potentially?
That's a hard question, isn't
Yeah,
it?
that is a very hard question. You've
well,
got to take it on
Yeah.
a case-by-case
Yeah,
basis, not only the not-for-profit itself, but all of the members, because there are a number of other underlying issues. Are you eligible for a subsidy if your employer doesn't offer affordable coverage? But what if there's spousal coverage available? Now you've gone through the calculation of the value of the subsidy, but if you're eligible for group insurance on an affordable basis, it'll eliminate you. So based on a marital status and spousal employment status and eligibility, it may take two people with similar incomes, similar family demographics, and one to be eligible and one not. So there's not an easy answer. You're going to have to explore what all the consequences may be, not only to the entity, but also to the individuals.
But let me ask you this, and I think this might be where you were going. Is it possible that a not-for-profit or a small organization that's already been doing its best to offer some health insurance to its employees, is it possible that they could have really a situation where if they stopped offering insurance, their employees might in fact be better off as well as they?
Yes.
It's certainly possible.
Yes.
And so they're not doing the wrong thing, quite the opposite, if they at least talked to their broker and considered that and tried to
Oh, it
balance
should
that on behalf.
absolutely be a
Yeah.
consideration
Yeah.
because we know a
Yeah.
number of not-for-profits have had to
Yeah.
terminate coverage from a pure financial standpoint over the last several years with the increases we've seen. So they really should evaluate that because it may be in the best interest of their employees.
Right. So they shouldn't be, I guess, afraid that they're abandoning their mission, quite the opposite, that
No.
they should at least find out whether they're possibly helping their employees that way.
Well, it's one of the purposes today is just to try to help the small organization recognize their role as advocate for their employees, for their staff, for their parishioners, whoever else that is they're giving direction for, whether they're providing coverage or not. So that's helpful. Other questions?
Myself.
Yeah.
Kind of piggybacking on that question, I've heard of small employers and nonprofits doing a hybrid of that, where they stop offering coverage, but they offer, for lack of better words, a subsidy to say, okay, we're not going to be able to do full freight, but we'll do half. You go out and do your thing, and we will offer this as a benefit to. What's the feasibility, and have you heard of that going on?
We're seeing a lot of activity and interest in that. That's where I mentioned earlier, maybe providing a stipend to the employee, so it's manageable. You aren't waiting for the insurance company to say how much expense you're going to have for health care, okay, for health insurance for your employees. You're going to tell the employee, we're going to give you X number of dollars, kind of a defined contribution concept, and you can go out to the marketplace, and maybe we'll even facilitate that. You can have what are called private exchanges, exchange marketplace. In the private exchange, the employer may go into sponsorship with a broker consultant who's going to be able to help the people determine how to use their stipend and what their options are for the. I think we're going to see a significant evolution to this defined contribution type concept. So what you suggest, the employer now says, I'm going to spend X number of dollars per employee, but I'm also going to give them some assistance, facilitation to understanding what the marketplace options are, and then they can make their own decision.
One of the things, I'm an executive pastor at a church, and what we're struggling with is we've always tried to, hey, let's take care of our pastors and let's provide full freight, and it's becoming less and less feasible to do that because of the each year the double-digit increases. So it's like we're a church, we're here to provide ministry, not to provide health insurance to all our employees. There's some break-even points there. But with this, what I see is some, and maybe you can comment on this, is that for the employer, for the church or nonprofit, if you offer a stipend, it stops the increases. It's a fixed element now where you can manage that better versus having to deal with what's going to happen next year with something that's out of our control for the budget. So it's something we can help. Just if you can comment on that.
Oh, absolutely. I think defined contribution for the small employer is going to be a major consideration because they will be able to project what their future cost will be. Unfortunately, may transfer a little of that risk to the employer. Remember, if there are increases or not, okay? May transfer, but allow the employer to be able to control their own finances better. The benefit to the member may be the member can decide what he wants. Rather than the defined benefit package, it was forced upon him for years. He can now say, you know what, I'm willing to take certain risk, or I'm willing to deal with a little more closely network. And the employee may feel now he's more involved, he will obviously feel he's more involved in the decision making. So I see it as definitely an alternative. Every small group, particularly not-for-profits and churches, should consider.
You know, that's a question I hear a lot too, is about the, the network or the trade-offs of choices that an individual might have to make if they're buying insurance through the marketplace. Yes, they have different choices to make, but what that might actually allow for them is a better fit with what they wanted. So as a small employer, the best you could probably do was to give a not real rich benefit package necessarily, and it did have to be kind of one size fits all for everybody within your organization. If you gave them instead that stipend and they would apply individually, they could choose for themselves, do I want the bronze plan that has the highest degree of a deductible and a co-insurance, or do I want the product that was a lot more predictability and I'm willing to pay more premium for low copays, low deductible. They can also make a different decision for themselves, for their spouse, for themselves and their dependents, even to the point of saying, I want the product that has this network because that's where the cardiologist or the hospital that I prefer is in, but my spouse wants a network that's maybe a little cheaper and a little less broad because his or her choices are met fine through that. So a little more flexibility is also maybe something that makes you feel better about not offering the plan that you
We
used
agree.
to offer.
Excellent. Any other questions? Yes.
I was wondering on Jimmy's question, is there a legal aspect of how much that has to be for, does every employee have to be equal? Can the senior pastor have a larger contribution than I know on offering the health insurance, you have to treat all employees the same. But on this stipend thing that you're talking about, is that the same thing?
I'm a broker, I don't practice law.
Yeah.
And there's anti-discrimination normally, to me, my experience is tied into, is it related to what they call HCE, or highly compensated employees? And I think that was something I would suggest you address if you feel you're running any risk of that with your legal advisor, okay? Because
Yeah, I'm
chime
afraid
in
I
on
don't know
that
the answer
from
to
a
that.
executive pastor viewpoint,
Yeah.
and also working with Servant Solutions. I know at the 403Bs that we work with, churches are exempt from discrimination rules. So you could
no, that's for,
do anything you want and slice it any way you want without being hit up with discrimination.
thanks you.
It might
I
give
did
you
not know
some
that.
flexibility, yeah. Good.
Over here?
When we're talking about stipends to the employee, is that before tax or after tax? And also, what is best for the employee? I've heard some talk about that you can pay that stipend to a third party, which sends it out to the insurance company. And is that taxable to the employee before tax or after tax, or not taxable?
The models are still being developed. If you give the employee a stipend to go out and buy his own coverage, I would say that's generally going to be a taxable event to the employee, okay? There are some models that are being developed. One is the Bloom Exchange, and they're going to have a single issuer, and the employee can select from about 6 to 8 different options. And to my understanding, the contribution made by the employer for the employee will retain its non-taxability. Okay? These are kind of a work in process, and some of the latter model I addressed are limited to potentially larger employers. But I think as we see this evolution go on, there's going to be some creativity that they're going to be able to be brought down to the smaller.
Another question?
If you're on Social Security disability right now, will you have to have any extra insurance?
I don't know
I don't know the answer to that.
Qualifying answer to that. But that one should be a fact-checking, so one of the navigators or one of those folks can answer that. CMS.gov should have a
Yes.
pretty clear answer about that one. That's correct.
That's correct.
But I don't know if Social Security disability. Yeah, that's right. So in that interim period, not sure. Yeah.
For one or two more questions?
Yeah.
An individual who is covered under their spouse's insurance plan, or does that meet the requirement of the individual mandate for that person?
If it's qualified health coverage, yes. Yeah. So
it's
if you're
required-
covered under your spouse's group plan, then yes, you've satisfied.
Very good.
Yeah. I think we've all seen, though, that spouse coverage has been an area that people have had to squeeze. So if you've still got it, it's
Be thankful, huh?
yeah.
Yes.
Another question?
I'm actually part of a large employer, and one of the things that has come up with the employer mandate one of the big questions that typically comes up, and it's come to me in several different avenues, is that the coverage is only, from our standpoint, applied to the employee. We offer spousal coverage at this point, but the question comes around to make this affordable for us at times, do we at some point cut off spousal coverage? And you know, I'm looking at the subsidy rates on here, and one of the questions that I have is, when a spouse then would have to go out to the exchange, is that based off of household income or just that spouse's income?
Again, I don't think there's an easy answer. I don't deal as much in the large employer market, but we're seeing like examples of that, like the large grocery chain. It's dropped dependent eligibility. My suspicion was that a number of those people would probably fall into an income bracket, which would make them eligible for subsidies. So they had to drop it. There's been also a trending toward excluded spousal exclusions because it involves a certain degree of anti-selection. That since the dependent cost coverage is normally higher, only those that are really going to use it and need it come on the plan. But again, there's not an easy answer to say, should I eliminate spousal coverage? I think that whether large or small, you got to look at on a case-by-case basis.
Okay, fantastic questions. I'll give it to Jeff for closing.
Well, we hope this has been helpful to you, and I have the rich task of just doing a few quick thank yous as we close out today. And the first one I want to mention is just a sincere expression of gratitude to Indiana Ministries of the Church of God. Without their work and underwriting, this would not have been possible this morning. They do a fantastic job. Doug Talley and Jeff Mattis were here earlier, and Cindy Talley is here and has handled a lot of the logistics and done a masterful job. So we truly thank them. Carl Addison, our host and opener this morning, has been behind the scenes making sure everything came off perfectly, and it's just been great. Also want to thank Creative Juices, Vince Vita and Carlos, your brother, Curtis Corzine, our owners, and their staff is here, and they've done a great job of making sure everything has just come off perfectly, and we thank them for their excellent work. Eastside Church of God, the host here, opening up their facilities to us. We're grateful. Also, I want to thank our panelists. They have done a superb job. They've spent time leading up to today to kind of prepare to try to break this down. And it's a very complex subject, as we've all come to realize. And I think that you've not made us experts this morning, but you have advanced the ball. We feel like we know more than when we came. So Liz Simpkin, thank you, president of the Accountable Care Consortium. Just a great job. Thank you for being here this morning. And David Burnett with Walker Group. Thanks so much. You guys have just done superb. And thank them.
And our Dr. Green as well.
Absolutely. And then Dr. Scott Green, a friend to all of us, who we know well and love, and not only just a local practitioner, but a world mission-oriented individual who's done so many great things and does so much in our community. Scott, thank you for your work. Thank him as well, if you would.
My pleasure.
And then just lastly, I just want to, as we close out and leave today, I want to say a thank you to the live audience here today. Those of you who have taken time out of your busy schedule to be here, we thank you for that. And also those who are tuning in through the internet and other means, we thank you as well. And I say that because we know, and the reason we were doing this morning, we know that the audience that is here is consistent and is made up of people who have really made some sacrifices to do what you do in the areas of your ministry, whether it's in not-for-profit social service, or if it's you're a pastor at a church or an administrator or leader of some variety in that context. You've made some significant sacrifices, and we are grateful for what you do. It makes a difference, and we hope that this small gift of providing the conference today is helpful to your lives and to the things that you have to manage on a daily basis. So we're grateful for that. Thanks to all of you, and Lord bless you. Have a great day.